Hi, my name is AJ Neal. The chapter I decided to do is chapter 11, which is called Exercise for Health and Fitness. Exercise is not only very good for your health, but it's also good mentally as well as physically. Exercise improves the functioning of the heart and ability of the cardiorespiratory system to carry oxygen to the body tissue. Exercising helps many diseases such as cardiorespiratory disease and also helps reduce the risk of cancer. Exercising helps reduce high blood pressure, improves blood fat levels, and helps improve immune system. Before exercising, warming up before and cooling down afterwards helps prevent injury and improves your performance. What are the 5 components of physical fitness most important to health are cardiorespiratory, endurance, muscular strength, endurance, flexibility, and body composition. Being able to maintain an exercise program causes you to have goals and able to maintain it. It will also help you try new activities once you achieve your goals. In order to have a good stretching program, it includes major exercises for muscle groups and joints of the body. What does exercise help reduce risk? Diseases, cancer, and improves the immune system is the correct answer. Regular physical activity can improve your muscle strength and boost your endurance. Exercise delivers oxygen and nutrients to your tissues and helps your cardiovascular system work more efficiently. And when your heart and lung health improve, you have more energy to tackle daily chores. Exercise is defined as any movement that makes your muscles work and requires body to burn calories. There are many types of physical activity, including swimming, running, jogging, walking, and dancing, to name a few. Being active has been shown to have many health benefits, both physically and mentally. It may even help you live longer. Research shows that physical activity can also boost self-esteem, mood, sleep quality, and energy, as well as reducing your risk of stress. What type of disabilities and exercise prevent? Type 2 is the answer. You have to make time for physical activity and have to be consistent with exercising. Stretching after you exercise is very important. It helps relax the muscles and prevents injury as well. Regular exercise can have a profoundly positive impact on depression, anxiety, and ADHD. Eating healthy also helps exercise the effect, and you'll be able to see results as well. As an athlete, I learned that working out has kept me very healthy. Eating healthy has also kept me healthy as well. Regular physical activity can help you fall asleep faster, get better sleep, and deepen your sleep. Just don't exercise too close to bedtime, or you may be too energized to go to sleep. Regular physical activity can improve energy and increase your confidence about your physical appearance. Exercise and physical activity can be enjoyable. They can give you a chance to unwind, enjoy the outdoors on simple, engaging activities that make you happy. Physical activity can also help you connect with your family or friends in a fun social setting. Getting at least 150 minutes of moderate aerobic activity or 75 minutes of vigorous aerobic activity a week, or a combination of moderate and vigorous activity. The guidelines suggest that you spread out this exercise during the course of a week to provide even greater health and benefit, and to assist with weight loss or maintaining weight loss. At least 300 minutes a week is recommended. But even small amounts of physical activity are helpful. Being active for short periods of time throughout the day can add up to provide health benefit. Do strength training exercise for all major muscle groups at least 2 times a week. Aim to do single set of each exercise using a weight or resistance level heavy enough to tire your muscle after 2 to 12, 15 repetitions. Moderate aerobic exercise includes activities such as brisk walking, biking, swimming, and mowing the lawn. Vigorous aerobic exercise includes activities such as running, heavy yard work, and aerobic dancing. Strength training can include use of weight machines, your own body weight, heavy bags, and resistance tubing, or resistance paddles in the water, or activities such as rock climbing. If you want to lose weight, meet specific fitness goals, or even get more benefits. You may need to ramp up your moderate and aerobic activity even more. In my PowerPoint, you'll see the benefits of exercise: improve cardiorespiratory functioning, more efficient metabolism, and improved cell health, improve body composition, disease prevention and management, improve psychological and emotional wellness, improve immune function, prevention of injuries and lower back pain, improve wellness for life. In the next slide, you will see what is physical fitness. It is a set physical attributes that allow the body to respond or adapt to the demands and stress of physical effort. Here are some quick stats. 83,564 Americans died from diabetes in 2017, making it to the 7th leading cause of death that year. Only 21.6% of high school students get at least 60 minutes of physical activity every day. More than 70 million Americans use health clubs in 2017, an increase of 6% since 2016. In my next slide, you'll see designing your exercise program. Here's a chart of flexibility training, sedentary activity, strength training, cardiorespiratory endurance exercise, moderate intensity physical activity. In my next slide, it shows cardiorespiratory endurance exercise. You will need frequency, intensity, time, type, volume of activity, progression, the warm-up, and the cool-down. In my next slide, it shows exercises for muscular strength and endurance. It shows resistance exercise and isometric exercise. My next slide shows managing your fitness program. 1. Starting slowly, getting in shape gradually. 2. Exercising consistently. 3. Assessing your fitness. 4. Preventing and managing athletic injuries. 5. Staying with your program. In conclusion, exercise improves the functioning of the heart and the ability of the respiratory system to carry oxygen to the body's tissue. It also increases metabolic efficiency and improves body composition. Exercise lowers the risk of cardiovascular disease by improving the blood fat levels, reducing high blood pressure, and interfering with the disease process that causes coronary artery blockage. Exercise reduces the risk of cancer, osteoporosis, and diabetes. It improves immune function and psychological health and helps prevent injuries and lower back pain. The 5 components of physical fitness most important to health are cardiorespiratory, endurance, muscular strength, muscular endurance, flexibility, and body composition. Warming up before exercising, cooling down afterwards improve your performance and decrease your chances of injury. Exercises that develop muscular strength and endurance involve exerting force against a significant resistance. A strength training program for general fitness typically involves 1 or more sets of 8 to 12 repetitions of 8 to 10 exercises performed on at least 2 non-session days per week. Cardiorespiratory endurance exercise stresses a large portion of the body's muscle mass. Endurance exercise should be performed 3 to 5 days per week for 20 to 60 minutes per day. Intensity can be evaluated by measuring the heart rate. A good stretching program includes the exercises for the major muscle groups and joints of the body. Do active static stretches and at least 2 to 3 days per week. Hold each stretch for 10 to 30 seconds and do 2 to 4 repetitions stretch when muscles are worn. A well-balanced diet contains all energy and nutrients needed to sustain a fitness program. When exercising, remember to drink enough fluids. Rest, ice, compression, and elevation are treatments for minor muscle and joint injuries. People can maintain a desired level of fitness by exercising 3 to 5 days a week at a consistent intensity. Strategies for maintaining an exercise program over the long term include having meaningful goals, varying the program, and trying new activities. Revisit and revise. If your program turns out to be unrealistic, revise it. Expect to make many adjustments in your program along the way. On some days, your progress will be excellent, but on others, you'll barely be able to drag yourself through your scheduled activities.